A health alert for parents tonight. Doctors declaring an early RSV season after seeing a spike in cases. RSV is a respiratory virus that can seriously impact children under 2 and the elderly. Here in Mecklenburg County, doctors say they've seen a major increase over the last 2 months. WCNC Charlotte's Ashley Daly is live for us outside Atrium Health. Ashley, do we know how full the Children's Hospital is at this point?
You know, Fred, we did ask Atrium for those numbers. Unfortunately, they weren't able to get them to us in time. We did hear from several moms over Facebook, however, that said the NICU here was so full that they were running out of incubators. We did hear from doctors, too, who said not only are they seeing an increase in COVID-19, kids positive with COVID-19, but also with RSV. In addition, they say there's simply more babies being born right now.
RSV is short for Respiratory Syncytial Virus.
The virus typically hits hard in the winter and dies down by April. But this year, doctors across the country say RSV cases started appearing as early as June and have been climbing ever since.
The thing is, we were all in masks through the winter.
Dr. Lynn Nuse is the specialty medical director for General Pediatrics at Atrium Health. She says RSV a somewhat common virus, which most kids will have before 2 years of age, but says the younger you are, the more dangerous it is, as RSV can inflame the lungs, leading to more than 58,000 hospitalizations every year, according to the CDC.
Very similar in symptoms to any other cold virus. It's runny nose, cough, congestion. You can get fever with it.
But doctors say its timing couldn't be worse, as the Delta variant continues to lead to more child hospitalizations and as cases of the virus, commonly known as croup, also increase.
We are seeing children, especially children who are being admitted to the hospital, testing positive for 2 or more viruses.
The perfect storm of respiratory viruses now all hitting kids at the same time and all hitting hard. Hospital systems once overwhelmed with adults now seeing the same shortages for our kids.
So much is happening at the same time that we're starting to see these shortages and the shortages of appointments, shortages of resources like incubators, shortages of appointments in your doctor's office.
Now, as for the best protection for kids, you can probably guess what doctors say: masks. Dr. Nuse said not only will a mask protect your child from getting COVID, but all respiratory viruses. And she says due to the fact that there were hardly any RSV cases last winter, proves that masks do work. Live at Atrium, Ashley Daly, WCNC Charlotte.